basic navigation and utilization of PEMSoft. What you see here is the user interface or home page for PEMSoft. The home page is divided into 5 distinct areas. The purple navigation bar provides different browser-styled buttons for easy navigation through the software. The left and middle columns are a collection of orange-colored buttons. These buttons are subdivided into the following categories: general patient assessment, clinical references, developmental and psychosocial topics, special topics in pediatrics, and organ-based diagnostic categories. When you click on a specific orange button, let's say cardiology, a new window opens with a list of organ-based diagnostic categories in the left-hand column now. Now on the right, there is an alphabetical index of subtopics, specifically in the area of pediatric cardiology. Scroll down to view the entire list of subtopics. On the right side of the home page, Phoenix is a helpful resuscitation calculator which allows you to calculate drug doses and equipment sizes based on the patient's age or length. On the right side of the home page, DocWriter is a document management system which allows you to upload any electronic documents to customize your PEMSoft system. On the right side of the home page, Consent View is our multilingual library of videotaped procedures. Voice explanations are directed at parents and caregivers. Let's take a look at the horizontal navigation bar at the top of the screen. You can get to the home page at any time by simply clicking on the home icon located at the upper left of the navigation bar. Clicking on the Go Back button allows you to return to the previous screen that you were just on. Clicking on the History button displays a drop-down menu of the last 19 pages that you visited. This allows you to navigate directly back to the desired page. PEMSoft has a robust search engine. Many clinicians feel that the search engine is the best way to start using the software when you have a particular clinical question in mind. This is often faster than navigating through the various sections and topics. For instance, enter a single term in the Search For box. This can be a disease, an injury, or a medical condition. Let's put in the term hyphema. This results in a list of topics and subtopics that contain the word hyphema. The search provides a rank or a relative number of times the search term appears. This provides a probability scale for matching the search word with the closest topic. To navigate to the topic or subtopic, either double-click on the subject or select it and click Go. Alternatively, the search button can be used to help you generate a differential diagnosis for a patient. The search engine allows the inclusion of up to 5 different signs or symptoms. For instance, enter the terms conjunctivitis, fever, and rash. When I click Search, the software locates 24 different conditions that manifest with these 3 physical characteristics. If I click on one of them, such as measles, the software will take you instantaneously to that topic. Let's take a more in-depth look at the content buttons in the left and middle hand columns of the home page. These buttons and topics are organized to allow you easy access to information that you want at the bedside quickly. For instance, let's select the button Signs and Symptoms under Assessment. The software contains a large database of approximately 100 different clinical signs and symptoms. These are alphabetically listed in this section. Select a topic, such as abdominal pain. To do so, you can either double-click on the topic abdominal pain or select the topic and then click the now blue highlighted button, Go to Selected Topic. What you will now see is a set of quick reference cards on acute abdominal pain. you automatically start on the main topic card. This card provides a description of the topic and important clinical information about assessment. The information is presented in a rapid access outline format with bullets, dashes, and asterisks. This allows you to access information quickly while at the bedside. On the right side list of menu bar items, there are a group of buttons called subtopics or minor topics. These buttons lead to cards with additional supporting information on the topic. The print function in PEMSoft by default prints the entire main topic and subtopics that you're on. If printed in its entirety, PEMSoft would be approximately 8,000 pages. Also on the right, the top beige graphic button allows you to toggle between text cards and the graphics figures for the topic. Alternatively, you can access particular multimedia files by clicking on the word image, displayed in green-colored font. For instance, by clicking on an image link under the subtopic Diagnostic Studies, you will be taken immediately to the appropriate figure. Next, at the bottom right corner of the screen, there are two important custom navigation buttons. The first one is the See Also button. Clicking on it opens a pop-up menu of associated topics which may be helpful in the clinical decision-making process. If we click on abdominal trauma, for instance, the software immediately navigates us to the abdominal trauma topic. Just below the See Also button is a special button called Custom Links. The Custom Links button is a button that permits a linkage between a main topic and any electronic PDF document that you have uploaded. Hospital-specific policies, procedures, protocols, and reference materials on the topic of, for instance, abdominal pain can now be imported by you or your administrator into the Doc Writer module of PEMSoft. This customization process will be described in the third training video. PEMSoft is far superior to traditional textbooks because of its digital platform, which allows you to easily navigate throughout the PEMSoft database. All keywords are cross-referenced and designated as an all uppercase blue-colored text. For example, within the abdominal pain topic, click on the subtopic Etiology by Age. A list of causes for abdominal pain are then presented by age. Clicking on any of the blue text will take you to a main topic card on that topic. Another example of cross-referenced linkage is what we call Smart Text. Smart Text allows the user to place the cursor on any medical term in the medical library, and the software will navigate to the topic or subtopic which is closest to the term selected. For instance, on the main topic page for abdominal pain, if I click on the word constipation, the software will take me instantaneously to that topic. While you are using PEMSoft, you will come to realize that the software is a fantastic resource because it contains an extensive multimedia collection. There are approximately 2,500 graphics files in the form of single images, slideshows, or movies. For example, when you go to eye trauma, select the graphics button on the right. We see that this swollen eye exam photo is a single image. However, if we select hyphema, which is just below that button, there are actually two images in the form of a slideshow. Click on the arrows at the bottom of each image to navigate. In addition to static images, there are approximately 120 videos in the PEMSoft library. Many of the videos are in the Procedures section. Let's take lumbar puncture, for example. Toggle into the graphics mode and then view the LP Technique movie. This movie provides a step-by-step voice-over explanation of how to do a lumbar puncture in a young child.
The patient should be placed in a lateral decubitus position. That is, they should be lying on their side perpendicular to the bed.
We have now reviewed the menu bar, the search engine, the navigational approaches to finding clinical information, and the extensive multimedia library of PEMSoft. This concludes training session number 1 on the basic navigation and utilization of PEMSoft.